Hi, I'm Robert. I'm going to be your nurse today. First, I'm going to start off by practicing GSPS. Can you verify your name and date of birth for me? Thank you. So today we're going to be doing a physical assessment from head to toe. I'm going to go ahead and state that everything I do on the left side I would do on the right side. We're going to be looking for things like your appearance. Are you in any kind of distress? Are you shortness of breath? Are you experiencing any kind of pain or anxiety today? Is your hygiene proper? Do you have good eye contact? Are your facial expressions normal? Things like that. First, we're going to start off with doing your vitals. So I've already got him hooked up to his oxygen machine. It tells me his oxygen and his heart rate currently. So what we're going to be checking for now is your temperature. Okay, temperature looks good. And we're going to also want to count the respiratory rate of his breathing, so we're going to do that by watching the chest rise and fall for 1 minute. We're going to do your blood pressure. All right, blood pressure looks good. Now we're going to move on to the head. And we're going to be looking for the size and the shape of the head to ensure that it's good. We're going to want to inspect the skull just to ensure that there is no cuts, scrapes, bruises, or anything like that on the skull. Now we're going to look at the face to see the color, the symmetry, and if there's any lesions or facial hair. Now we're going to want to go down into the ears, and what we're going to be looking for in the ears, do they have any kind of hearing aids? Is there any kind of foreign bodies? Excuse me. Do they have any kind of drainage? Do they have edema or serum or the bilateral shape of the ears, the size? We're going to be looking at the neck as well. For swallowing, we're going to be looking for speech. Do they have clear speech, slurred speech? And then we're going to do the nose. And we're going to see if there's any kind of drainage. And then we're going to look in the mouth to see if the mucosa is pink and moist, in which yours looks to be. And then we're going to want to go down into the body. Everything I do on the left, I'm going to do on the right. We're going to do a skin turgor on the chest. And then we're going to look for any kind of redness, rashes, anything like that. We're going to look at the arms to ensure that there's no edema, no skin breakdown or redness, stuff like that. Then we're going to also look at the back. And then we're going to do a skin turgor on the back, ensure that there's no redness, breakdown of the skin or anything like that. We can also do a capillary reflex on the fingers to ensure hydration status. And then when you're on the back, you can look for the sacral breakdown if there's a history of it. And you move down to the legs to ensure that the body is symmetrical. You want to look at the legs to make sure there's no signs of breakdown or anything like that in the legs. In the feet and in the heels, you would want no more breakdown, especially in immobile patients or bedridden patients. And while we're doing this, we're going to want to get a history from the patient, a past medical history, their current vaccinations, their education, Are they on any current medications, their allergies, their economical status, their health care, do they have access to health care, do they have everything they need, the quality of their neighborhood, the environment they live in, or if they have any kind of social issues. So that would conclude my head to toe assessment.